Dr. Walter Lemmo, our guest, he is a naturopath. He has a specialty in oncology, and he runs an organization called Thrive Alive.
Yes, Thrive Alive Foundation.
Because we want to be alive and we want to thrive. And you're having a gala, right? Soon, the Dolce Vita Gala?
That's exactly right. It's actually next Wednesday at Heritage Hall in Vancouver. And it's going to be a fantastic show. We got some great food like Mythos Taverna in North Vancouver sponsoring it.
Oh, great.
We got Whole Foods.
Good Greek food.
Yeah, exactly. And it's going to be a total fashion show. So you're going to have, we actually have people who had, say, a cancer diagnosis and they're actually going to be modeling, strutting their stuff, wearing shirts that's called Thrive, a great kind of momentum. And it's all about supporting and trying to help people fund treatments not covered by government health care.
How great,
funds.
great
Yeah.
idea. So if you want to strut your stuff
Yes.
and die well, die at 100, feeling good, where does inflammation fit into the picture? In any body, but in the male body specifically.
Yeah, what we're finding out now that inflammation is one of these probably, our true silent killer, so to speak. And we see that kind of correlated with, say, with diabetes, with heart disease, including stress too. Stress actually increases inflammation too. And it's like a rusting on the body. So in my practice, sometimes what we're looking at is even as inflammatory markers in patients. So you hear about like C-reactive protein, ferritin, and other things. And those could be wonderful markers like the cholesterol in terms of, your body's under a bit of a load. So the question is like, well, what does that mean and what do we do about it? And the number one thing that can help to decrease inflammation no matter what you got to move, right?
Okay.
Yeah, you got to move. And you know what I'm thinking about there is a story like my fiance's grandfather, AKA Grandpa. He's 87 years old. He's had his heart issues, prostate issues. He really had a really bad fall recently. And you know what the common variable throughout that whole thing, and he's still kicking and mentally sharp? He's moving. And
He's moving,
yeah.
Cardio-wise or just walking and playing golf?
Going to the gym, walking around. Say, when he was in the hospital, he was in a stroller, going around and around and around. And so he told me something. He goes, Walter, whether you like it or not, you got to move. And so that one variable alone can actually decrease a lot of these inflammatory markers.
Sure.
And then aside from that, you're also hearing a lot these days, talk about, say, aspirin as an example. We know that's kind of used in cardiovascular disease. And there's been some talk about using for cancer risks and others. And so what that's telling you too in groups of patients or people that this inflammation can be a real severe thing, and by calming that down could really improve all these types
everything,
all the parameters.
Right, so is there a diet, an anti-inflammatory diet, foods to stay away from?
So the core things obviously is indulgence, right? Too much is not good.
Okay.
And so that's the key. And then obviously in terms of, the refined stuff, you hear about the grains and the white breads, pastas. The fats, that in terms of men, there's a lot of talk about the red meats. We know the barbecues.
Right.
And we got to kind of calm those down in terms of those kinds of fats. But one kind of food source that I feel could be used right across a group of men that can help with blood pressure issues, that can help with cholesterol issues, that can help with prostate cancer issues, and I think it can actually even help with colon kind of issues and beyond. Ground flax seeds. Ground flaxseed meal, there's actually research right across the board with using that food source.
The ground seeds, not just the oil?
Yeah, the seeds, not the oil, the ground flax seeds, because there's more fiber than oat bran in those things.
Okay.
There's minerals in those things. And so you can sprinkle them on your cereal, your salads, like a tablespoon, 2 or 3. The only thing you got to watch with that is you got to watch the bowels, right? So there's more fiber than oat bran. That one food source alone is simple and easy, because with guys, you got to keep it simple and easy and cost effective.
You noticed.
Yes.
Women finely tuned computers. Men are nuts and bolts, but keep it easy. Say, throw some flax in your shake, throw some flax on your oatmeal, throw some flax in a muffin, or ask whoever's cooking for you to throw some flax in the muffin. And often women take care of their men. As you know, they say, honey,
Yes.
I don't know what that lump is on your elbow, but it doesn't look right.
That's right.
So strokes, mini strokes, warning signs, is that all linked to hypertension? Some of it what?
Yes, it's all linked. So in terms of warning signs, like obviously people have any headache, any confusion. You know, you hear about that analogy with the smile, you know, with, if they're kind of showing they're going like this, and if there's a deviation in one side, because you're looking for paralysis issues. So,
Right.
so it's a reality. You got to watch it, and we know the number one risk factor for that is lowering your blood pressure.
So what are the numbers? What do you think the good numbers are for blood pressure?
Well, obviously it depends who you talk to, right? But so the magic numbers are 120 over 80. In reality, you want to be below 140 over 80 or 90 for most. But remember one thing with blood pressure, the key is here too, is you don't want to get paranoid about it as well. So if you're doing these kind of blood pressure readings, you want to do them at a place the same time, lying down, and try to get because the blood pressure could deviate throughout the day.
Sure.
So, and then going to the doctor, there's a group of men, right, that gets a little bit raveled up, so to speak. So the key is do them like not all the time. Try to do them like, say, you know, once a month, and get that little trend from there.
Sure, I use the little machine, the little at-home machine, and you can take it to your doctor and make sure it's accurate, because I have white coat syndrome. I go to my doctor, she says, try to go to Hawaii. And then she takes my blood pressure and she says to me, I didn't tell you to go to Afghanistan. I told you to go to Hawaii. And then I go home and I take my blood pressure and it's fine. So there you go, we have that too. So depression, not necessarily a male issue, but more men commit suicide.
Yeah,
warning signs.
Yeah, when you're looking at obviously the suicide risk compared to women and men, it's like with men it could be like, you know, 3 times higher in terms of the numbers. So, and I think a big problem for men is versus women. You know, we have these stoic kind of personalities.
Right.
You know, is it okay for men to kind of express themselves, to cry? You know, to
apparently it is.
Yeah.
So don't bottle it up.
That's
male or female.
Male or female.
Let it out.
But with men, like, you know, there is this tendency that you tend to see, and so obviously if you're seeing like you know, abnormal behavior, the families are kind of noticing certain patterns. Obviously, if there was an attempt at some kind before, taking too many pills, that kind of world. But the key is men got to realize they got to talk to people. You got to let these things out. Yeah.
And the other key is if you have a lump, a bump, a something, a blood, whatever. And a colonoscopy is not all that bad.
No, it's not.
Had one?
Not yet.
I've had several, and they're really fun. Don't worry about it. How nice to see you.
It's a pleasure. Thank you.
Dr. Walter Lemmo, and the Dolce Vita Gala is happening next Wednesday, is it? Yeah.
Yes.
November 30th, Heritage Hall, Main Street.